Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. We are talking about the different kinds of hepatitis. Express Care's Dr. Jitka Lom is here in studio providing us with details about each of the types of the disease and how to treat it. But we also wanted to get to some of our questions. The first one is, can I get hepatitis A from eating fruits and vegetables? If so, how can I prevent this?
Yes, you could if you were in a third world country, perhaps, where the things are not washed very well. So when you travel to countries like that, you probably should not eat fruits and vegetables that you yourself have not washed or peeled. So salads and things like that, you probably want to steer away from. Peel your own fruit and vegetables, make sure you wash them well. Even putting a little tiny bit of bleach, or you can buy these dissolving sort of disinfecting tablets to help you clean your fruit and vegetables.
But otherwise, yeah, like
here on Guam, we don't thankfully don't have that.
Okay.
Yeah.
Hepatitis A can cause liver problems, as we talked about. Is there any way to prevent that from happening?
Well, hepatitis A basically is a liver problem, so if you get it, then your liver will be short-term damaged. But one of the amazing things about the liver is that it regenerates so well. It's the detox center of our body, you know, and so even if you give it a really bad time with hepatitis, or maybe even just alcohol, that's another form of hepatitis. If you drink tons of alcohol, you'll get alcoholic hepatitis. That insult to your liver can often be rectified, and the liver can repair itself. In the case of hepatitis A, that always happens.
So how do you do that? You just refrain?
Yeah, for alcohol, yeah, stop drinking. And there's also a supplement that you can take for any liver disease, and that's called milk thistle extract. The generic name is Silmarin, and you can buy that in a vitamin store or even at Kmart or whatever in the vitamin section, and that helps cleanse your liver and helps it heal. So anybody with any fatty liver, which is very common on Guam, or you drink too much, or any other sort of liver disease, can take Silmarin, and that helps you heal naturally.
All right. Mm-hmm. I heard sharing razors or toothbrushes. I don't know why people do that. I heard it can result in spreading hepatitis C.
Yeah, get your color-coded toothbrush. So hepatitis B and C, again, are from body fluids, most particularly blood. So when people brush their teeth, their gums may bleed. They may have a tiny little bit of virus on that toothbrush, and then somebody else uses it and can get that. Same with razors, tiny little shaving cuts. So first of all, don't share your toothbrushes and all that. And then if you have hepatitis B or C, then you can talk to your healthcare provider about ways to protect your family. Hepatitis B, of course, has a vaccine. Hepatitis C does not. Okay. So A and B have a vaccine, C and the others don't.
Okay. I was diagnosed with Hep B and have incredibly itchy skin. What do you recommend, Doc?
Oh, yes. And you know what? Any liver disease, particularly the hepatitis that's more advanced, will give you jaundice and also itchy skin. It's one of the things that comes along with liver disease, and it comes from too much bilirubin, which is processed through the liver, too much bilirubin being deposited in your skin. And it's a difficult problem. So taking it back to the origin, try to fix your liver as much as you can. Of course, don't drink alcohol, take your medication, take the milk thistle, drink lots of water, and then you can take some medicines to help the itch. Benadryl doesn't work that well, but there are other prescription medicines that you can try. Moisturizing helps, and we can use UV light also. That helps a lot. Just like they give it to the babies for jaundice, you can give it to adults, and it helps a little.
Okay, I was just diagnosed with hepatitis C. I'm worried about passing on the disease. Is there anything I can do?
Yes, that's through body fluids and blood again, so using condoms would be very, very important for you. Of course, not sharing any toothbrushes, avoiding contact with your blood or any body fluid.
Okay, how do I deal with the fatigue that comes with having hepatitis?
That's a really difficult one, yeah. Healthy lifestyle, positive thinking. Those are the two most important things. Keeping your thoughts positive, and drinking lots of water, and exercising, eating properly, getting enough rest and sleep. All of those things are very important when you have any chronic disease, but certainly hepatitis.
Okay, and our last question is, because of all the liver problems associated with hepatitis, is it safe to drink alcohol from time to time?
Nope. No, it's really not.
Probably not the answer to
that one. Yeah, no, I mean, you already have a problem. Could you have a glass of wine once a year? Okay, but more than that, no. Because you really don't want to cause your poor liver any more overload than it's already dealing with.
Okay, any last words of wisdom regarding hepatitis for our viewers?
if you are maybe over the age of 50, you might consider getting screened, as it's now recommended by the CDC in America, as there are so many people who are undiagnosed.
All right, sounds good. Thank you, Doc, for that.
You're welcome.
And we've got a really interesting topic next week. Doc will return, and we're going to be talking about athlete's foot and jacket. You picked the greatest topic. We're back right after this.